Good afternoon, everyone, and welcome to our fourth dialogue session of the dialogue series organized by the SDSN Zero Hunger Pathways Project. My name is Bassel, and I'm a research scientist at Texas A&M University and co-chair of the Zero Hunger Pathways Project. I co-chair this project together with Alicia Powers from the Hunger Solutions Initiative at Auburn University and Asma Latif from the SDG2 Advocacy Hub. Before I hand it over to our moderator for today, I'd like to start with a bit of a background about the Zero Hunger Pathways Project, especially for those of you who might be joining us for the first time today. The Zero Hunger Pathways Project developed out of a desire among SDSN USA network members and partners to connect research and science with policy toward ending hunger in the US. As we know, ending hunger is a complex challenge. It requires multisectoral and multidisciplinary approaches that include different dimensions related to food, health, nutrition, education, looking at historic inequities, unemployment, social protection, among others. Currently, approaches to address hunger place a premium on access to sufficient calories and too little attention to the quality of nutrients that are available, accessible, and utilized by low-income households. So we find that these approaches often emphasize food assistance, but do not necessarily address the underlying causes of hunger. So in order for us to achieve the zero hunger goal of the Sustainable Development Goals by 2030, we need actionable, scalable, and innovative solutions that allow us to address these root causes as we move forward. So the Hunger Pathways Project, the Zero Hunger Pathways Project, focuses on taking a systems approach to ending hunger in the US while aligning with the United Nations Sustainable Development Goal, especially the SDG2 dedicated to ending hunger in 2030. Through a consensus-driven process, our working group has identified 4 foundational areas of focus that characterize the pathways we want to explore. We are interested in exploring pathways that are equitable, resilient, sustainable, and healthy and nutritious for all. We are also interested in arriving to these pathways through engaging with different academics and stakeholders in the space. So one of the key activities that our project is doing and conducting is this dialogue series, which aims to bring together a cross-disciplinary group of experts to develop recommendations for a roadmap to zero hunger in the US with action-oriented outputs linking science to policy. These dialogue series are also rooted in the same 4 core values: equity, resilience, health, and sustainability. We have conducted 3 dialogues so far in the past year. One that focused on improving health and nutrition outcomes through SNAP, second that focused on situational analysis of hunger, of the state of hunger in the US, and the third that focused on trade-off evaluation and science policy communication, the outcomes of which were submitted to the UN Food Systems Summit. And today, we are really pleased to have with us this 4th dialogue focused on taking innovations to scale. And it's our great pleasure to introduce Jeremy Everett, the founder and executive director of the Baylor Collaborative on Hunger and Poverty, who will be moderating our session today and leading us through this dialogue. Jeremy, the floor is yours.
Thank you, Bassel, and thanks for everybody participating today. I've been looking forward to this conversation for some time, in part because creating scalable solutions is core to the work that we do at the Baylor Collaborative on Hunger and Poverty, and in part because you all are bringing a variety of expertise and experience literally from across the globe, trying to address hunger and malnutrition and starvation and various rates of food insecurity all over the world. And so we are grateful for the work that you do, and we are grateful to be able to have a little over an hour this afternoon to be able to share some ideas for how we collectively work to bend the world towards justice. Now, we've all been in communities and visited communities and seen community-based interventions where people pull us to the side and they show us, hey, this is a best practice. Or they tell us, hey, this intervention is an intervention that's ready to scale, whether that be in other communities or other states or other countries, but they're very excited and eager to share us what they've been able to experience and accomplish. Now, sometimes they're right. Sometimes they have built some scalable models that are ready to grow beyond maybe that particular intervention. But oftentimes they might be missing some steps. They may have identified a great intervention, but they may be missing some steps that prevent it from moving to scale as quickly as they desire. So today we'll be discussing how do we create scalable solutions to end hunger. Now, my role is the executive director at the Baylor Collaborative on Hunger and Poverty, and our mission is to cultivate scalable solutions to end hunger. So this is very core to what we do on a daily basis. We have 18 different projects right now, all over the country and some in a few other countries, all looking for how do we create some scalable solutions so that we can hopefully have a world without hunger sooner than later. And so now we believe that hunger and poverty are too big for any one organization or any one sector to address by themselves. So we build multisectoral collaborative projects around every intervention that we do. And so sometimes that will include government, sometimes that will include nonprofit organizations or NGOs, sometimes that will include industry, sometimes faith communities. But we believe that no one particular intervention is going to lead us on the pathway of sustainability if it's done by one particular sector or one particular organization for the long haul. So that's an important aspect of our model. When we think about creating scalable solutions to end hunger, we really work in three particular areas. So we believe there are three keys to scalability. The first is research. If research isn't informing the intervention and then not evaluating the different interventions, then oftentimes the pathway to scale is going to be met with considerable hardship. Otherwise, we don't really have a good idea of whether or not that particular intervention is worthy of scaling to a different community. So research is core to our work. Now, we're fortunate to have 50 or 60 researchers at the collaborative that are part of our research fellows program that are involved in providing up-to-date research on a daily basis. The second area is practice. And so many of our colleagues who work in different aspects of the food system, who are working different aspects of research, they might have their own laboratory where they perform their research. But we know for us who are working in communities on a day-to-day basis that communities oftentimes operate as our laboratories. Not because we're trying to test out different things on people, but because we have to be immersed in their daily reality if we're going to adequately identify what the actual problems are. And so Brian Stevenson, the author of Just Mercy, says, you can't solve a social problem from a distance. You have to have proximity to the problem. And so we believe it's important to be embedded in communities and for that work, for that practice work to be in conversation with researchers in real time. And when you do that, you're more likely to adequately identify or accurately identify problems that need to be solved, and your solutions are more likely going to be right. The third area is in policy. The third key to scale is in policy. So all of the work that we're involved with is beginning to drive towards policy. It either begins by looking at a particular federal or global policy, or it has one in mind, or in some cases, it might be the need to develop new policy type interventions. Most large-scale interventions to end hunger have policy as a core component of it and have been critical towards getting those interventions to scale. So that's a bit of the framework that we're working with today. So the conversations as we break out, both as we hear from our two experts and as we break out into breakout rooms to have further discussion, are going to be what what needs to happen to create more scalable solutions to end hunger. Maybe what are some of the projects that you're working on, and it can be an opportunity for you to have some dialogue with your colleagues that are in your breakout rooms to determine what pathways to scale you might need to include in order to achieve some of the goals that you've laid forth. But it should be a really fruitful dialogue. Today, we have two experts with us, and we're very grateful for their time and their willingness to share in the work that they do. Dr. Lori Kanitz, who serves as Director of Federal Programs on our team at the Baylor Collaborative on Hunger and Poverty. She leads a particular project called Meals to You, which is a project that had to be scaled from a small project in East and West Texas nationwide to address rural hunger, or hunger in very remote areas in the country during the pandemic. And so she'll speak to that and talk about her pathway to scale and our team's pathway to scale as it relates to providing food to children when they're out of school. Our second guest is Reverend Jonathan Grant. Jonathan serves as the Executive Director of the World Hunger Relief Organization, which also has a training farm, a sustainable agriculture training farm here in Central Texas. They have been instrumental in partnering with our federally qualified health centers, an organization now called Waco Family Practice, in developing a produce prescription model where they have identified families that are either experiencing food insecurity or malnutrition or have high rates of diet-related disease, and are literally providing them some of the healthiest, highest quality food that we have available to us in Central Texas. And so he's going to tell you about that particular program. Now, the four values that we're going to highlight today are going to be equity. First of all, when we think about equity, oftentimes we think about equity as in terms of racial disparities and access, but sometimes equity comes in the landscape of, are our federal nutrition programs, for example, working in urban areas but not working in rural areas? And so if you have rural communities that don't have access to some of our federal nutrition program, that becomes an issue of equity. How do we ensure equity or equitable access to families in those circumstances? When we think about equity and the access to healthy food for families who live in food deserts, some of the work that Jonathan's team is addressing, when we think about equity of access, that's a core component. Other food is healthy food access. And so Jonathan and his team, are growing organically grown food here and really focused on maintaining access to healthy food for families who may not have readily accessible access because of limitations in transportation to be able to get to supermarkets and grocery stores. And then sustainability. Are we doing this in a way that is healthy both for the land and that can be a long-term intervention that can hopefully transform systems and structures in order to ensure that no one goes hungry in our nation or around the world. And then finally, resilience. What is it what are the critical interventions that have shown resilience through the test of time? So that's what we're going to be looking at today. I want to define a few terms so that we have some common operating terms because we certainly are going to throw these around a pretty good bit. Multisectoral is a word that's already been thrown around, I think, by Bassel and myself multiple times. What we mean by that is that you've got different sectors, whether that's government, that could be local, state, or federal government. It could even include the UN and what they're doing with Sustainable Development Goals. That could be paired with the private sector or industry. So what we're doing with large-scale farming operations, or what we're doing in seeing these multinational companies, or what you're seeing local business engaging. In addition to that, we talk about the NGOs, or non-governmental organizations, and nonprofit organizations are going to be interspersed. More than likely, if we're talking about global work, you're going to hear the word NGO thrown around. If we're talking about domestic work, nonprofit organizations. And then faith communities would be churches and mosques and and temples of all varieties that might be engaging this issue because their faith compels them to do so. So multisectoral is a word that you're going to hear thrown around some the rest of this afternoon. Other terms, hunger is oftentimes used interchangeably with food insecurity. Now, they don't mean the same thing, but they tend to point in the same direction. And so by hunger, we literally mean the pains of not having access to food, where somebody is literally missing meals because they do not have access to food for a variety of reasons. Food insecurity, as we talked about it in the U.S., means that you don't have enough access to food to live an adequate, healthy lifestyle, or not enough adequate access to live an active, healthy lifestyle. And so those terms sometimes get thrown around interchangeably, but don't necessarily mean the same thing. The last would be starvation. We have seen the rates of starvation double really since COVID. It's said from about 135 million people to 270 million people worldwide. And so that's certainly something that's on the forefront of our minds. And that would be extreme hunger or very low food security as in terms of the defining terms that we use in the US. So those are a few terms, but with that, I want to turn it over to my colleague, Dr. Lori Kanitz, so that she can begin to outline for us the Meals to You program. And so she's intending to give an overview for you over the next 15 minutes or so to give you clarity on the program itself and how she created it with her team to scale. So, Lori.
Thank you so much, Jeremy, and everyone. It's just such an honor to be able to share with you briefly about the Meals to You program, and I'm just looking forward to the dialogue later about it. So as Jeremy mentioned, one of the core values is proximity. And so through over a decade of field work that BCHIP has had, which is our short term for the Baylor Collaborative on Hunger and Poverty, so you may hear me using that. In our field work, we've gained proximity to the issues of hunger and discerned a need, particularly with rural communities. As many of you may be aware, the Summer Food Service Program does a phenomenal job of funding and providing food for children over the summer when school is out at congregate feeding sites. However, for rural communities, getting to those congregate feeding sites is sometimes a challenge, either because of distance or lack of transportation. So we began to think about, well, what would be an innovative solution, an intervention that could get food to these children? And this is really, as Jeremy mentioned, an equity issue, that just because a child lives in a rural community does not mean that that child should have no access to healthy food over the summer when schools are out. And so, EBTs are useful if you have a grocery store nearby, but rural communities oftentimes do not have that. So what was devised was a program we call Meals to You. And it's a 3-year pilot program that is administered by the Baylor Collaborative on Hunger and Poverty and funded by the USDA, U.S. Department of Agriculture. And the way that it works is that rural school districts participating in the National School Lunch Program identify and then verify eligible children who are then enrolled in the Meals to You program. And by eligible, we mean those who would have access to free and reduced price meals during the school year. So each child who is enrolled every week during the summer break receives a box of shelf-stable food delivered to their home that includes 5 breakfasts, 5 lunches, or they could be dinners, and 5 snacks for the duration of the break. And those meals meet USDA requirements for SFSP nutritional guidelines. So in 2019, we tested this model in about 20 Texas school districts, as Jeremy mentioned, in West Texas and East Texas. And then in the spring of 2020, we were expanding that same footprint to also include districts in New Mexico and Alaska. And then, of course, you all know what happened in March of 2020. So when COVID-19 was full blown and schools were forced to close unexpectedly, that meant a lot of children didn't have access to school meals. So USDA funded a very rapid and dramatic expansion of the program to be nationwide. And that's what we refer to internally as the Emergency Meals to You program. So just a couple of numbers to give you a sense of the scale. So between these two programs in the spring and summer of 2020, we shipped almost 2 million boxes of food. That's about 39.2 million meals to approximately 300,000 children in about 130,000 households. So we went from serving districts just in Texas to a nationwide program that included 43 states and Puerto Rico. This past summer, summer 21, we're just now wrapping up. We've sent approximately 50,000 boxes, about 500,000 meals to about 2,000 school children. And that includes 49 districts in Texas, Alaska, and New Mexico. So we've gone from a one state program to a national program and then to a multi-state program. And I think the expansion for Emergency Meals to You was like literally over a weekend. So it happened very, very quickly. As Jeremy mentioned, for things to be sustainable and scalable, they need to be data-driven, especially if we want to make the case for long-term policy changes. So those that, for example, might make Meals to You an intervention that would be a long-term option for rural children. So from the beginning, we've had external partners that are independent researchers. We have contracted with Urban Institute, a nonprofit, and Healthy Eating Research at Duke, who are gathering data on all aspects of the program, from shipping to nutritional value of the meal boxes, to the customer satisfaction. And the goal is that we want to identify best practices for long-term solutions, but also so we can make iterative changes over the 3 years of the program, and hopefully have something that's scalable, but also a really meaningful intervention for low-income folks in rural communities. So we now have data that has confirmed a very significant reduction in food insecurity for spring and summer of 2020. In fact, we just got this report from Urban on Friday, and I'd be happy to say more about that if we have time later. We also have internal partners and efforts. We, as part of Emergency Meals to You, had a competitive subgrant award process where we are now funding 3 Baylor faculty members to do research around the efficacy of Emergency Meals to You during COVID-19. And then internally, we're constantly reevaluating. For example, last fall, after the dust had settled after Emergency Meals to You, we had a 4-day multi-session internal retrospective about all aspects of the program to sort of identify what went well, but also for the 3rd year where we could make some improvements. So I'll just share a couple of the key findings from all of that. 3 areas that are really necessary we determined for scaling. One of those is enrollment and ongoing support for the school districts and the families as the program runs. So because these are rural communities, there are a lot of challenges that just to enrollment and access to information. So for example, the lack of access to stable Wi-Fi or any Wi-Fi at all, or a lack of transportation to a site where they could use Wi-Fi. So for example, we had fabulous school district coordinators who came up with creative solutions like taking mobile hotspots to folks so they could enroll. We also came up with a case manager's approach so that every single school district was assigned a B-CHIP staff case manager who could develop a close working relationship with that school district, get to know the coordinator, get to know literally the landscape of that area, and find an innovative solution for enrolling families. So whether that was a custom built enrollment process that we put together in less than 24 hours for a school district in Stebbins, Alaska, which is on an island off the coast, or like I mentioned, mobile hotspots, that case manager model really worked well. We also wanted to reduce the burden on families and school districts for enrollment and ongoing support. So in year 2, we had a custom built Salesforce platform unique to Meals to You that provides school districts as well as families a little bit more autonomy in terms of enrollment, updating data, and so on to reduce some of the administrative burden. The second area that required innovations for scaling was shipping. So as all of you know, during COVID-19, supply chain issues were pandemic. So, but when you're working with rural communities, the last mile is often the real challenge. So we had communities, like I said, off the coast of Alaska. We had a community at the bottom of the Grand Canyon. So we had to work very closely in dialogue with our vendors, but also with the carriers that were going that last mile to identify in real time hotspots. So where were there a lot of damages? Where were boxes getting hung up? And how do we build processes that can avoid those and minimize damages? Rural post offices are small. And so when you're talking about 200 boxes arriving for 200 school children for that community, that presents some challenges. So we had weekly, sometimes daily dialogue with our amazing vendors. We had dialogue about the sort of last mile challenges with all three carriers, USPS, FedEx, Chartwells. And then we also recognized through that feedback and those conversations how important it was to have on the ground relationships with the local postmasters, with the people in the Anchorage, Alaska hub, and so on. Then the third area of challenge or innovations necessary for scaling is technology and data management. I mean, as you can imagine, when you've got 2 million boxes and you have to have real-time data on every single box, that is a lot of data. So creating the best practices and the technology necessary to support that data management was really crucial. And then also to be sure that our system and our vendor system could be in sync, that they could talk to each other. So vendors, their parcel systems are not standardized. So it required a lot of, again, dialogue. And then in response to some of these challenges in year 2, we also were able to hire a phenomenal data manager who has just created systems based on best practices that have really helped us make sure that the data is clean. And we've got real-time information and solutions, whether that's figuring out a problem with billing or a tracking status with a box and answering a client's question. We can now do that with much more accuracy. So those are the 3 areas. And I went fairly quickly just because I didn't know how much time this would all take, but Jeremy, I'll turn it back over to you and for your final comments on resilience and equity.
Yeah, thank you, Lori. That was absolutely excellent, and we're very grateful for your work. I think there are a couple big takeaways here that I want to make sure that we highlighted. So in the summer of 2019, Lori said that 4,000 children participated in a 10-week demonstration project that yielded about 500,000 meals and snacks to kids in that first summer. The second summer ended up being scaled because of the realities of COVID-19. The project was asked to scale nationwide, ended up serving children in 43 states plus Puerto Rico, and served nearly 270,000 or more than 270,000 children 2 meals a day, resulting in about 40 million meals served to that particular program. I want to speak specifically to the issue of equity. I think one of the things that was uncovered in part to our surprise, our job is to really have a team of people that are experts, not only in addressing hunger, but understanding it. And I think even with a team of people that are focused on this work on a daily basis, I think we were all very surprised at how severe food insecurity is in rural America, and how the deck really was stacked against families in a way that was even beyond our comprehension, even though we're working directly with many of these communities in real time. So when we think about equity, first of all, we know that there's a major wage gap in America of people that are making $7.25 an hour, even if they were able to get 40 hours worth of work a week, are only bringing home less than $15,000 a year. But we know that most families that are working and minimum wage paying jobs do not have access to full-time employment with one employer. And we know that families who are in rural communities, they don't have public transit to be able to get to urban areas where they might have a larger job market. And so opportunities for them to have gainful employment are really few and far between, which leads in normal times to income volatility, meaning that they make an unpredictable amount of money on a week-to-week basis because they can't predict how many hours they're going to get with their employer. So some weeks it might be 10 hours, other weeks it might be 20 hours. And so income volatility and low wage work leads to high rates of food insecurity. But when you added in the pandemic, particularly in these rural communities, not only were they didn't have adequate healthcare access or primary healthcare access, we saw the pandemic, businesses shut down for periods of time. And so, that disproportionately affected individuals who were in low wage jobs where they couldn't work from home and Zoom in like many of us had the opportunity to. So when we think about equity, those are a few things that really stood out to us. So thank you, Lori, for your presentation. Additionally, just the sheer remoteness of some individuals in the U.S. We think of the U.S. as being a very well-connected place with maybe crumbling infrastructure, but still infrastructure in terms of roads and bridges and then places to be able to get food to families who need it. But one of the school districts that they called us from Alaska said that they were 300 miles from the nearest road system. And road system, not just anything, but road system. And so we know that Lori's team literally had to get seaplanes and helicopters and even dog sled teams to be able to get boxes of food to children who are in these remote locations. And we also heard stories from some tribal communities who are in incredibly isolated areas in the U.S., particularly Western U.S., one of which is at the bottom of the Grand Canyon. And they literally needed mule teams to be able to deliver boxes of food down to them. And then USPS drivers and UPS drivers delivering food everywhere else. Another thing that Lori briefly mentioned was in the area of resilience. So one of the things that was identified as this particular intervention was initially moving from concept to implementation was how can we have as light of environmental footprint as we possibly could. And so it was determined at that point to be able to use traditional shipping sources, since we know that USPS drivers and UPS trucks are going back and forth to these communities with regularity. It was determined to utilize that infrastructure in order to provide boxes of food to children so as not to add another layer of vehicles going back and forth to these communities. So to really kind of build upon what already was. So those are a few things that I'm noting. Lori, thank you for your presentation and for your team's work to address this particular inequity that we see in American society. I want to turn now to Reverend Grant. Jonathan is somebody I've known for decades, and very few people on this planet work as tirelessly and as hard and are as focused on addressing these issues as Jonathan and his team are at World Hunger Relief. Jonathan, if you would, tell us about the produce prescription program. Maybe give us a brief overview of World Hunger Relief and then particularly this particular intervention, how it came to be and its impact in community and how y'all brought it to scale.
Thanks, Jeremy. The farm, as we refer to it, World Hunger Relief Farm, is about 42 years old and was initially incorporated to be what I would call an agricultural mission sending organization. We were an education facility that trained interns, over 400 interns to date, who would learn farming practices, educational practices that they could then go and travel around the state, around the nation, around the world, and implement these practices in places that found it difficult to feed folks, to build community, and was quite successful. As we all know, your own context is critically important to what you do and how you go about it. And McLennan County, where we live, is an incredibly educated community. We have Baylor University here, McLennan County Community College, Texas State Technical College. So we have a lot of folks who have a good number of degrees behind their name, but we're also what some would refer to as the buckle of the Baptist belt. We have lots and lots of churches here. We have lots and lots of people of faith. And yet somehow McLennan County is at the 24 percentile of food insecurity. The state average is 10%. Our own community is at 24%. And that's just a sobering statistic that with so many educated, smart, brilliant people, with so many people of faith, and yet we find ourselves in the midst of a hunger, food security crisis here. And so years ago, what used to be called, well, it's now called Waco Family Medicine, began to realize that a majority of their patients were dealing with diet-related illnesses, that it was what they were eating that was causing their ailments. And so they began to dream and then partnered with us on scaling a plan that might address these things. And we reached out to the Episcopal Health Foundation. And so the three of us put together what's called the Produce Prescription Program, or PRX for short. And the intent is that the Waco Family Medicine doctors will see a patient that is dealing with some kind of diet-related illness. We'll ask them about their habits and dietary plans, and then gauge their interest in participating in the program, and then write them a prescription for this program. Meanwhile, our folks here at the farm are growing fresh, organically grown produce, preparing them, boxing them, delivering them to the Waco Family Medicine Clinic, so that when the patient takes the prescription down the hallway, they can turn it in and receive a half bushel of 6 or 7 different vegetables, along with recipes and nutritional information on what all they receive. We have been incredibly fortunate to be able to work with Dr. Kelly Ulitalo from the Robbins College at Baylor, who's an epidemiologist, and her team, as well as the doctors at Waco Family Medicine, who from the very beginning have been collecting information and data at each engagement. Whenever somebody picks up a box, they're handed a questionnaire to fill out there about have they come before, have they used, what all have they used in the box, all those kinds of things. So our data points have been growing from the very beginning, because our hope wasn't just to change a habit, our hope was to change health. And we figured if we could change habit enough for enough people in our community, that then the overall trajectory of the health in our community would change as well. Initially, we delivered to 1 clinic. Over the last 5 years, we have now started delivering to 6 different clinics. We deliver 150 boxes a week for 12 weeks in the spring, 12 to 14 weeks in the spring, 12 weeks in the fall. Just a variety and assortment of what we can grow here in our own climate. We have found several different challenges. For us, this program isn't just about feeding people. It's not just about filling a gut. It's about providing nutritious options for folks who aren't necessarily missing meals, but when you live in the midst of a food desert, many of your meals come from a convenience store burrito, or from fast food, or from things that just aren't building health. They're filling guts, but they aren't building health, which, as we know, are leading to high blood pressure and diabetes and obesity and all kinds of different things. And so at the farm, we work hard to live within a rhythm, live within our capacity, live within what for us Christ calls us to do, but live within our margins so that we can come back to work the next day fueled and able to do it again. It's the whole notion of being a regenerative farm and using regenerative systems. And so one of the issues, I think I went unmuted there for a second. One of the issues we came to the realization with when we value our own regenerative nature as people, as a system, as a farm, is scale. And so we were able to scale up to a certain amount of boxes per week based on the number of people we have, based on the number of land we have, based on the number of water we have access to, and learned that at a certain point we've reached our max as a farm, and we're there. And so the new challenge is to build partnerships with other local farmers who might be interested in joining in this process to scale up to another level of providing fresh produce to local challenges. Now, the beautiful thing, again, is that we are in a place that has people that are passionate about sharing their gifts. You know, we have lots and lots of people involved in different kinds of congregations, and we have lots of folks that are highly educated, and once they realize the issues that are before them, they want to help. And so we aren't necessarily facing a scaling issue of not enough resources. It's just about connecting the potential resources and aligning them in such a way that we can continue on and maximize the possibilities here. So we've just completed our 5th year, which is 10 growing seasons, and have found some pretty remarkable data that says that we are changing habits, that folks are returning over and over to the program, that they are consuming all of the boxes. First of all of the boxes, but generally one a year are consumed. So it's like 3,200 boxes. One gets dropped somewhere in the process of delivery, but everything else is being handed out, and a large majority is being consumed and not thrown away when it gets into the home. So we know that habits are changing. We know that that the interest is absolutely there. We deliver on Tuesdays and Thursdays, and by the end of those days, the boxes are gone. And so now the challenge for us is building partnerships with local farmers. Well, the farming population is decreasing every year. It's not increasing. The people that are interested in doing the work to grow healthy produce is in and of itself is a challenging process. But as a nonprofit, we are afforded the privilege of reaching out to our community of people interested in joining us in this process. And it's not a very hard sell to any of those people, not at all. I will say that the biggest challenge for us now is just listening to our own rhythms and knowing when we're at capacity, knowing when we're at scale, and in the meantime, lining up those partners so that we can grow capacity and not have to stall and plan from there on out. I think that's pretty much most of what I have, Jeremy.
Great. That's great. Jonathan, thank you for your work. I have literally been able to participate in this program from seed, from seeding the fields to delivery, and then meeting with physicians and meeting with participants. Admittedly, when I first encountered the program, it was one of my favorite programs that the farm has been a part of. But also was a bit skeptical. I was a bit skeptical that that participants would eat the entire box worth of produce. It's a significant amount of produce that is delivered to families, even though they have a recipe so they can know how to prepare it. But it was after spending time with the physicians and leadership at the Waco Family Medicine federally qualified health centers that I became convinced, and meeting with participants. And what we learned is that this is not merely a cosmetic intervention and an educational intervention, but this is a real substantive intervention that is making a real difference in individuals' lives across our community. And so, Jonathan, I appreciate that you pointed out that this is a program that has grown to scale. It was initially imagined for an intervention with a couple of clinics in mind, but it didn't take too long for 2 clinics to become 4 and for it to continue to grow from there. And so we know, and we're grateful for your practices of being committed to sustainable agriculture, to ensure that you're not only caring for the health and well-being of people who live in low-income households in McLennan County, but you're also caring for the health and well-being of the soil and your farm and your animals to ensure the longevity of agriculture in our particular space. Now, Jonathan identified a couple of gaps for scale, and I think that's something that we're going to want to deal with as once we get in our breakout groups. And so let's talk a little bit about what we have to come. So for the next 35 minutes until 4:25 Eastern time, about 3:25 or 5:25 Eastern time, about 4:25 Central time, we're going to have an opportunity for breakout discussions. And so you're going to be put into 2, possibly 3 different breakout rooms that are going to be facilitated by Dr. Lori Kanitz and Jonathan Grant, and then either myself or Grace Norman if we have a third room. And here's what we're going to do. In part, we're going to turn, this will be an opportunity for you to ask them questions. We also want to turn the questions to you. And here are some of the questions that we would like to delve into. First, from your experience, what innovative anti-hunger initiatives address equity, healthy diets, resilience, and sustainability? And what needs to happen to scale these initiatives? Now, you don't need to remember these. Our facilitators will remind you of the question, but that's our first question. The second one is going to be, what are challenges to addressing intersecting issues with one initiative? And the third are, what is needed to encourage innovation and interdisciplinary approaches to addressing hunger, whether that be in your community or around the country or even around the world. So that's where we're going in these breakout rooms. If you're able to turn your camera on once you move into the breakout rooms, that will help our facilitators facilitate the conversation. We recognize that we are in a Zoom world, and so if you've got pets in your lap, or you're in the middle of your office, or you're in a shared space, don't worry about it. What's important to us is to be able to see you and have conversation with you as we learn from each other. Now, one more final note. Each group is going to need to report back to the larger group once you come back. And so if you'll designate someone to report back to the larger group once you get there, we would much appreciate it. Well, welcome back to our 2 groups. I hope that your conversations were fruitful. I know that ours was in group 1 as we touch base on scalable solutions and briefly highlighted some of the work that Lori described, but then really jumped into a number of other things. So you were supposed to have somebody who was willing to report back to the group. So I'm gonna, I know that John Pewter was volunteered or voluntold to report back to the larger group about what we discussed in group 1. So John, I'm gonna pick on you, and then our group 2 person will pick on you when John concludes. So John, give us an overview of what was discussed in group 1.
Okay, let's start by having me confess that I'm a horrible note taker. And I cringe at the idea that I'm going to be the one reporting back for our group, because I doubt I'm got it all, and I know I'm not going to get it completely accurate, but we'll give it a shot. So we talked about a whole lot of stuff, but I think the first thing we really talked about was the need for relationships and making these initiatives be successful and for them to grow. And I think a key point of it is that we need to ground our work within our practice, that we're not going to learn that what we need to do as far as creating these initiatives and making sure the initiatives meet the 4 pillars of our goal is that we need to not just simply be away from the problem, but we have to be immersed in the problem. We have to have folks in the field. We have to have ourselves involved in the initiatives that we're dealing with on a regular basis. And I think another key point that we pulled out from it is that as we work on the different initiatives and different ways to address hunger and food insecurity, is not to let the 4 pillars drive our work and not to allow that to necessarily stop us from what we're doing, but to start building what we're doing and then come back and address to make sure that we're addressing those 4 goals, and that we may not always be able to be 100% successful in reaching all 4 of those pillars, but that we can't let the perfect be the stop us from reaching the possible. And that's what I took away from that part of that discussion, is that even though, like when we were doing the Meals to You campaign or the Emergency Meals to You campaign, that we had to figure out how to get that food to kids, even though it may not be the most organic, healthiest food in the world, but we had to make it self-sustainable. We had to make it something that could move product as quickly as possible and be sustainable for families. And so I think while we always want to drive to reach those 4 points, that we can't let those 4 points stop us from doing what we think needs to be done. I think another thing we'd really talked about was the need to deal with some systemic equity challenges that we've seen in the past, that there's been a history of particularly the Black farmers, but farmers of color not always receiving the same equitable treatment that we really would like to see, and make sure that all of us receive and deserve, and that those challenges need to be addressed. We're missing out on a great resource by not being inclusive and not bringing all together, and that we've really done a disservice to many of our farmers and small farmers, and we've seen a significant decline. I think another thing we talked about is the fact that we can't allow our work to be siloed. And the only way we're going to be successful is if we become the leaders that bring together the different pillars that can join different organizations, whether it be government, nonprofits, schools, faith-based, private sector, that it's really a challenge to bring them all together, buy them a lunch. We all agreed that we're willing to fork over the money for one lunch to make sure we can get folks in a room together to start talking, because it's amazing what can be done when we put all of these different minds together and willing to work together on one simple problem, which is feeding folks. So that's kind of what my notes say. I'm sure I missed a lot, and I apologize if I missed your key point, but feel free to jump in and correct. But that's what I got, Jeremy.
Thanks, John. Anybody else from Group 1 want to add anything to what John provided us in terms of an overview?
I want to add some things very, very briefly. Thank you for all the information. As I was thinking about it, and I mentioned in the group that where I am, Georgia Rural Health Innovation Center, in the rural space, especially in Georgia, you're seeing hunger and food insecurity used interchangeably. I just came across a report and I'm thinking hunger and food insecurity is not the same. And they're not defining it as, the pain and the feeling. It's more so still economic. So I'm looking at this whole beautiful report that's telling me absolutely nothing. So now it's, I'm thinking of different ways and synthesize how can we truly measure hunger where it's not correlated with food insecurity and saying that's the same thing. And then to, with the audacity to say, we're going to use it interchangeably. That doesn't make any sense to me. So I was just thinking about that as I synthesized this information. Yeah. Well, Kimberly, just you probably know this already, but I'll food insecurity was developed it really is an economic measurement, as you well know, that was developed by USDA's Economic Research Service Center as a way to measure people that don't have access to enough, adequate, healthy food to live an active, healthy lifestyle. And so that has a variety of levels within that metric. For some families, that means that they are missing meals, sometimes with regularity. We would call that very low food security. Where other families, it might mean that they're having to alter their eating consumptions. Maybe they're purchasing, higher processed foods that will, try to fill them up, but that are cheaper to be able to make it to the end of a pay period.
And so you hear hunger and food insecurity used interchangeably, largely because the larger landscape of American citizens, or even when you think about the global community, they don't really understand the technical definition of food insecurity. And so you'll hear those terms used interchangeably, but you're right that they are not the same thing. But they're kind of lending itself in the same direction. And I would say, because of the intersectionality of issues, when we talk about ending hunger, you can't end hunger if you don't deal with structural racism, which was pointed out, in our session. You can't, end hunger if you don't deal with criminal justice related issues, or if you don't deal with logistical barriers to food access. And so there's so many issues that are inextricably intertwined with the realities of hunger or food insecurity. And so that's why you oftentimes hear those terms used interchangeably. But I'm very excited about what you're going to be doing in Georgia on this front, and with your organization's ground game that you have there, because rural innovation is definitely something that needs to happen. Yes, as Dr. Wild mentioned, yes, you can't. You're not going to end hunger if we don't deal with economic justice. So, okay, group 2. Who is reporting out from group 2?
That's me. I'm Grace Norman, also with the Baylor Collaborative on Hunger and Poverty. And I have the honor of actually serving on the board with World Hunger Relief as well. So worked with that organization for a couple of years and have seen the produce prescription program grow and change with community needs. So we had some pretty universal themes come out of our discussion, which it sounds like, John, in your group, you all also touched on this, but I think we would be remiss if we don't say that the programs that we currently have, the federal nutrition programs, namely SNAP, they work, they empower people to buy their own food. And so when we talked about equity in our space, we talked about co-creation and really paying attention to people that are participating in the process. And so we have programs like SNAP, or even the GusNIP program that allows for, like a dollar for dollar incentive with various produce items in certain geographies that empower consumers to buy what they know is best for their household. And so this, produce prescription program and then also the Meals to You program are not presented as this should be a new solution that takes the place of anything that already exists. More so, we're still seeing some gaps in some places, whether that's locally in Waco, families really tying and understanding. We all know that health and hunger go hand in hand, but a family doesn't necessarily see that maybe what they're eating is contributing to some of what they're seeing the doctor for. And so when they're able to link that, even in a physical space of, I go to the doctor, I talk to the doctor, and then I get a box of produce to implement some of the diet related changes my doctor has prescribed, we're able to see that change. But we had some great themes come up just around people taking ownership of their own intervention. And so when that comes to, Jonathan talked a little bit about creating this peer group with produce prescription program participants. But then beyond that, it sounded like, I think Diane Sullivan on our group talked about how it's so important to have culturally appropriate foods, and how will you know what's culturally appropriate if you haven't sat down and talked to families. And so really understanding who the end user is huge in further telling that story and empowering communities, but then also bringing the link to what we are putting in our bodies and people seeing that created locally, even if they aren't necessarily able to access what Jonathan grows on his farm day in and day out, but understanding that pears do grow on trees here in Waco, Texas, and people are able to take advantage of that. And then ultimately looking at the broader system and who is bearing the cost for healthy food. Is that something that your typical family that's going to a food pantry or relying on SNAP can afford? At the same time, how are we incentivizing local agriculture to support their communities? And so we did have a good bit of discussion around the GusNIP or like, what is it called? The Finney program, GusNIP now, for produce incentives of just how do you put the power back in people's hands in a way that they see where their food comes from. So that was also drawn as a more intermediate intervention to take what veggie prescription program is or produce prescription program is doing and how could we see this on a broader scale. I'll talk about my report out like John talked about his and say that I tried to take notes, and we'll email this over to the SDSN group. But please, if I forgot to report on anything that was mentioned in our session, feel free to jump in now.
Hi, everyone. This is Diane. Grace, thank you so much. You did a great job of capturing that. And, you know, I think for the first group, John, you mentioned, you know, the importance of building relationships. And I think what I'd really like to stress, and again, we could talk all day about this, the reasons why, is the importance of building relationships with the individuals who have been impacted, those with lived and living experience of hunger, because it really is an expertise. And I would love to see more of this particular expertise in all of these spaces. I don't think there should be a conversation about hunger where the experience isn't in the room, and the people who are bringing the experience and that expertise know that they belong. As you mentioned, Grace, that empowerment is so important. So I just wanted to just sort of double back and stress that.
Grace, could I jump in as well? We had a long discussion also about the connections between biodiversity, sustainability, and the long-term health and well-being of, you know, populations, and how those things are really connected, and the sort of gaps in policy that are looking at these things in a holistic way.
Well, it sounds like you all covered about 2 weeks worth of information in 30 minutes. So I don't know how you were able to do it, but I'm very impressed. Well, thanks everybody for participating in this. Obviously, this is a continual conversation that needs to be had. Diane, I especially appreciate your point that people who are experiencing food insecurity have to be at the table. Otherwise, we will build solutions that won't work, even regardless of our best intentions. And so that proximity is certainly key as we think about scalable solutions. You all bring a variety of expertise to the table. And so whether that's administering or assessing federal nutrition programs and their interventions, fortunately, we do have in the US a great cadre of federal nutrition programs. Our 15 federal nutrition programs are scalable solutions to addressing hunger in our communities, but they do have a number of gaps, as Asma's pointing out. So whether that's thinking about food sovereignty issues, whether that's thinking about justice as it relates to the land, who has access to it, who can grow food on it, who's historically been omitted from that process. So there are a number of gaps, certainly, that we need to address to strengthen our American food system and our global food system to ensure that we are creating healthy food in a sustainable way for all people, and regardless of who they are or where they live. You all are leading that fight. And so it is a privilege to be able to be on a Zoom with you. I know many of you that we've been able to work together for decades. And many of you have worked with many of my colleagues, and so we're grateful for the input that you have in addressing these issues. And thank you for sharing your time with us today. I'm going to turn it back over to Bassel and to Asma, I believe, or Sonia. I believe there might be a form that they want us to, an assessment form they want us to fill out. But thank you again for participating in this session on looking at scalable solutions to end hunger.